24 hours, 7 days a week, COVID hotline to take phone calls from across the region for free for anybody who had concerns that they were maybe experiencing COVID or exposed to COVID. And I was sitting in this room trying to figure out how to set that up, and everybody's kind of looking around, nobody, and I said, okay, I'll try to set it up. So starting Friday morning, March 13th, sitting in my in a room in my house, I took 40 calls from people in our county who were concerned about COVID. Saturday, I got a couple volunteers to jump on with me, and we took about 100 calls. Sunday, 150. Monday, 270 phone calls. And in that first year, and by this time I had recruited over 100 volunteers, we did 40,000 calls. And so that was 2020 for me here. I spent a lot of time on television on behalf of Metro Health to help talk about COVID and what the latest variant meant, and treatment and testing and everything that was available. And I loved the work. I was happy being a primary care physician at Metro, doing this other leadership work there. And then the job got posted to be Director of Public Health for the city of Cleveland. And I said, well, maybe one day, I could do that. But a number of my friends and professional peers down had an interview with the mayor and got sworn in August 1st, 2022, which was that picture on the right. Thank you. Now, we do air quality for the whole region. We do food safety, so all the restaurants we inspect. We do lead poisoning investigation. We have epidemiologists who investigate trends and emergency department visits. We print birth and death certificates. We have an infant mortality, community health worker home visitation program. It's just an incredible diverse department. I'm really proud of the team. This is the challenge in front of us. So, in the city of Cleveland, life expectancy for our residents is in the mid-60s. In the inner ring suburbs, so just 1 mile, 2.2 kilometers, 1.6 kilometers away, the life expectancy in those suburbs is in the high 80s. Just a short distance away. And the reason for that is the system of oppression in our country and many other countries of racism. And so on the right, you can see this line graph of life expectancy for Black residents in the United States compared to white residents in other races. And it's not really narrowing over time. It's going back to 1970 to present. This life expectancy is persistent. And the slide says racism, not race, kills residents in Cleveland. But the importance of that distinction is, for me in healthcare, and for any of you who might be learning any healthcare classes, unfortunately, a lot of times we'll learn that, there's some gene in Black people that's not in white people, and that's why they're dying. Well, that is completely false. There isn't genetic differences between races. There are genetic differences between ancestries, but that's different. And so it really is a systems of oppression called racism that's killing people in Cleveland. And now I'm going to show you some examples. So the two biggest forces that lead to this life expectancy discrepancy is wealth gap and segregation. First, wealth gap. So in the United States, for every $1 of wealth that a white family has, a Black family has 12 cents. And same thing, that wealth gap has not been closing over time. It's been persistent. The reason for that wealth gap is 400 years ago, slavery, the original sin for our country. Later on, Jim Crow laws, which punish people for being Black. Redlining, where banks in the United States gave favorable loans to white people, but not Black people. State-sanctioned violence, where police were basically hired and told to go into black neighborhoods and create violence. GI Bill benefits, so you sign up for the Army in the United States, come back from World War I and World War II, and white families were getting money and free education, and black families were not, because they were denied to black families. And there are many more examples that have created that wealth gap. The second force is segregation. So in Cleveland, this is a map of Cleveland on the left that Cleveland residents are really familiar with. Those red areas are predominantly our majority black neighborhoods in the city of Cleveland. In the bank documents of the 1930s, in that tax, as a result of segregation, this is what Cleveland looks like today, where on the map on the left is highlighting where black residents live, and the map on the right is highlighting the highest areas of poverty in the city of Cleveland. And they overlap quite a bit due to structural racism. So how does that lead to premature mortality? How does that lead to life expectancy differences of 20 years? So I'm going to show you a few examples. Example number one is traffic fatalities. People dying from getting hit by a car, or a car hitting a stationary object, or a car hitting another car. This is a map from our Vision Zero campaign. Vision Zero being we want zero traffic fatalities in Cleveland. We've had, a couple years ago, we had 80. Highest frequency of fatal or serious car accidents. So there are certain intersections, certain streets in Cleveland, because they have fewer trees, because they are wider, with less traffic calming physical measures, with fewer roundabouts, more people are dying. This is the system that's creating this. There's not an inherent difference between people who drive on the east side of Cleveland and people who drive on the west side of Cleveland or in the suburbs. They all pretty goes to the same driving school, if they go to driving school. And so the intersections are killing people. A second example, in Cleveland, we have, unfortunately, probably the highest lead poisoning rate in the country. The neighborhoods that light up are where our lead poisoning is the highest. We've made some progress to go down from 26% to just under 10% of our children have lead poisoning. For those unfamiliar with lead poisoning, when a baby tests positive for lead, or when they have lead in their blood, that causes irreversible neurotoxicity, brain damage. And so they have learning disabilities, they're more prone to behavioral disturbances for their entire life. And in Cleveland, the reason for that is because the houses were built before 1978, when lead paint became illegal. And in wealthier neighborhoods where those old houses exist, they've long been renovated and painted over, invested in. But in poorer neighborhoods in Cleveland, they have not gotten those same bank loans, those same investments. And so the homes look like this, some of them, and they're peeling paint, and a child will be crawling around near a windowsill and end up with that lead paint in their blood. So that's a second example. A third example is, you'll get the slides if you want the picture. I see, we'll get it. We'll send it to you. A third example is internet access. So in Cleveland, in those same red areas, even if you had a lot of money and lived in one of those neighborhoods, you can't buy high-speed internet. And that's because when internet companies like AT&T came to Cleveland, they dug up and built these deep cables in the streets, under the streets, in the wealthier neighborhoods, but not the poor neighborhoods. So they didn't build the infrastructure. They just skipped certain neighborhoods. And so internet, as you all know, is a connection to education, work, wealth generation, and even healthcare. because of, now we use patient portals for a lot of things, to request refills, to message with your doctor. And so for certain neighborhoods to not have access to that high-speed internet is another example of structural racism leading to these health disparities. A fourth example is food access. In Cleveland, there are neighborhoods, the same neighborhoods that market kind of orange those areas, without access to healthy grocers. What they have in place in many neighborhoods is grocery, gas station, liquor store, tobacco retailer, like you see on the right, which is where a lot of people are only able to get food, which unfortunately comes in a bag or a can, as opposed to fresh fruit and vegetables that we see in wealthier neighborhoods in Northeast Ohio. Fifth and final example, and then I promise we'll pivot to solutions and optimism, is cigarette smoking. Cleveland's smoking rate is 35%. 35% of adults in the city of Cleveland have smoked a cigarette in the last 30 days. We're not talking about vapes yet. That's just cigarettes. The rest of the country's smoking rate is now down to 11%. Over the last 20 years, it was 20%, now it's 11% for the country. The word is out on cigarettes. But in Cleveland, unfortunately, it went from 30% to 35%. Smoking is the number one preventable cause of death, disability, disease in Cleveland, and probably the rest of the world too. Importantly, the majority of people who smoke want to quit. The majority of people who smoke want to quit, but it's so hard, particularly flavored tobacco products like menthol cigarettes, because menthol masks the harsh taste of tobacco, and people who smoke menthol end up breathing it deeper and developing more nicotine receptors in their brain, so they have more cravings and it's more addictive. 35% in the city of Cleveland. You might say, well, why Cleveland? Why has the rest of the country's smoking rate gone down while Cleveland's has gone up? Well, it's structural racism. It wasn't an accident. Big tobacco companies, the companies that own all the cigarette products all over the world, had a decision to make as word got out that cigarettes are bad for health. It became illegal to advertise cigarettes on television and radio in 1970 and 1971 in the United States. So at that point, our smoking rate as a country started going down. The marketing executives for these tobacco companies sat in a room and said, all right, we've got to find new customers. And they said, okay, how about kids? How about poor people? And how about black people? And this is just the conversation about United States market. So you are all a global audience. As many of you know, Big Tobacco also took all of their marketing ideas and took them to particularly poor countries throughout the world. But in the United States, their marketing strategy meant Cleveland. And now all those documents are public as a result of a big lawsuit in 1997 called the Master Settlement Agreement. And you can see in those documents it says, we're going to go to Cleveland, we're going to go to black neighborhoods, we're going to go to black music events, and we're going to pass out free menthol cigarettes. And so while in the 1950s and 1960s, if you were black and you smoked, 5% smoked menthol, today it's nearly 90% because of a specific directed marketing campaign that you can see in these pictures. In Cleveland as well, there are 600 stores that sell cigarettes. That's one for every 600 residents. More than 3 out of 4 of our schools have a tobacco retailer within 2 blocks. And so it's in your face, it's everywhere. As a result, it's not just a high smoking rate that we have. You've seen the life expectancy slide. This is how that happens. Our lung cancer deaths per 100,000 population, where Cleveland is at top of that bar graph. We are far exceed all the other cities in the country in terms of lung cancer deaths per 100,000 residents. A final point on structural racism, I think before I pivot to optimism, is these systems of oppression aren't the only reason for the life expectancy difference in Cleveland. There's also interpersonal racism and major life events racism, where residents of Cleveland who are black are treated differently on a day-to-day basis. And it's not just Cleveland, it's the rest of our country too, and many other countries. Causing that, so what can we do about it? So I'm going to go now into some examples of what we're all doing to fix this, and maybe how you can help too. So number one, those intersections on that map. You know, I showed you there were specific streets in Cleveland where people were more likely to get hit by a car and die, or be in a car and run into a building and die, or be in a fatal serious accident. So we can fix those intersections or fix those streets and make them look like this picture. And we are doing that, many at a time right now. It takes a long time we have now devoted $20 million to go back to the east side of Cleveland, invest in high-speed internet. We've invited an international internet company to come in and build those deep infrastructure cables that were missed out in the past, and so all that will start pretty soon. Lead poisoning. So, as I told you, it's the homes that's poisoning children in the city of Cleveland. It's not the water. Our water actually is fantastic. It's really the houses. And so we know we can hold out-of-state landlords accountable for poisoning children so that they have to renovate their homes. We can build more safe, affordable housing, and so on. We're advocating for food justice in the city of Cleveland, so we have a number of buildings that look like this on the left, and we're working with local farmers and local growers so they can look like this on the right, particularly in areas with the lowest food access. And then for smoking, we're doing a lot of education to expose the racial justice history of tobacco companies, specifically menthol cigarettes. So we've got advertisements, we've got billboards, videos, we've got the leader of the NAACP Cleveland, who's become a spokesperson for us. We've been doing events with all the faith leaders, specifically the black faith leaders in our community, been on the radio, on television, in the news, talking about this terrible history and about how our smoking rate's so high. And we're helping to link people who smoke to cessation resources. You don't have to bother scanning this QR code because it's the local Cleveland cessation resources, but as I said, most people want to quit, and they just, it's just so hard to quit. And so we're trying to make that easier through linking to resources, but also we're trying to make that easier by ending the sale of flavored tobacco products in the city of Cleveland, which is legislation that we've proposed to our city council, and they're still kind of sitting on it, but we proposed it to them. A number of your countries have already done this, including Ethiopia, banned menthol cigarettes. A number of states in the United States, Massachusetts, California, a few others are working on it, have done this. Columbus is our capital city in Ohio has done this, and so we're hoping to be next. We're also setting up a tobacco retail license system where we would register all the 600 tobacco retailers so they would have health inspectors from our department in there. So we're working on that. And then I'll turn to you. And our Congress passed a law to ban the sale of flavored cigarettes. Cherry, vanilla, chocolate, and so on. But they unfortunately were lobbied to make an exception for menthol. And the reason at the time was because it had already become the black cigarette, and there was this pitch from tobacco companies that banning that cigarette too would be racist, even though all the white cigarettes and every other cigarette was banned. Years later, of course, that was exposed as wrong. And now we're trying to reverse that trend. The federal government has an opportunity now to ban the menthol cigarette. Menthol has a cooling cessation. It's mint, it's minty. It suppresses your cough reflex, so you end up really breathing deeper. It's more addictive as a cigarette. And because of that marketing that I showed you, it became specifically targeted towards the black community in the United States, and women and Latinos in the United States. And so, as a result, smoking rates have declined for the majority of the country, but a lot of minority populations, they've continued to go up, or they haven't dropped as quickly. Now, flavored vape products are a similar issue, where, and you can see this picture of all these different types of vapes. They're becoming huge throughout the world. The flavors of vape products include cotton candy, bubble gum, tropical splash. And it's clear those flavors are being marketed towards children. They're right next to the candy in convenience stores, right next to schools. And so, while there are some people who go from cigarettes to vapes, which probably puff per puff is healthier, a lot of new folks are getting addicted to nicotine because of these products. Yes.
Thank you for the presentation.
As I said, has been working to finally complete the flavor ban of cigarettes, and has the rule to ban menthol cigarettes in the White House right now. And they announced yesterday or the day before that they're going to delay that, keep thinking about it till March. And there are tobacco lobbyists, so people paid by tobacco companies, who have really been saying, hey, no, black people are not ready to quit the menthol cigarette, you're taking something away. But for every one spokesperson who's saying that, there are 99 health advocates, black leaders in our country who are pushing to correct this injustice and ban the menthol cigarette. And their voices in the end will hopefully be louder. But at the moment, money talks, and tobacco in our country is a big industry. It makes a lot of money, and that money is buying a lot of influence. To the factories, checking all of their filters, doing running tests to make sure that they're within the legal limits. The legal limits are set at a federal level and a state level. They are more aggressive than they were 20, 30 years ago as a result of the environmental movement in the United States, which a lot of it started in Cleveland when our Cuyahoga River caught on fire. Have you guys heard that story yet? Oh yeah, so our river caught on fire 50 years ago and 60 years ago, and that started a big environmental movement and awakening that, we gotta fix this. And so they did. The water's much cleaner now in Cuyahoga River, which is the river that runs through the city. And they created the Environmental Protection Agency, which is the federal agency that sets these limits. And so we're in there, we're checking. The state Environmental Protection Agency, as you can imagine, is much more conservative. So they support the businesses instead of the people. And so they try and break all those rules. But we're in there. We wish the rules were more strict, but each year they've gotten more strict. And so hope